Many students are returning to in-person learning after a school year with so many starts and stops because of the pandemic. So some could be feeling a bit jittery with the aggressive Delta variant now in place. Joining us this morning is Hartford Healthcare's Dr. Newfield, Chair of Psychiatry at St. Vincent Medical Center. Doctor, thank you for your time this morning.
Thanks so much for having me, Alyssa.
Absolutely. So I guess the first question we have this morning is, what are you hearing from parents regarding the jitters that students may have this year?
You know, certainly a lot of parents are happy to just have their kids going back to school and hoping for a more normal year. But for sure, they are hearing that their children are more anxious about what's to be expected and how things will go, and hopefully that schools will remain open.
Absolutely. And so you must be hearing that from the children that you see as well.
Exactly. Yes.
Are they feeling anxious, especially those who are under 12, because they aren't eligible for the vaccine? Is that a main concern right now?
I think certainly that age group, being more at risk because they aren't eligible for vaccinations just yet, and hopefully that will be coming soon. But that certainly weighs a little bit heavier on them than on the older kids that we're seeing.
Absolutely, I'd imagine so. And it's been a difficult time for parents. I mean, there's so many unknowns still about this virus. So should parents bring up the subject of the coronavirus, the Delta variant, vaccinations, or do you think it's best that they wait until their child raises it?
So I'm definitely a proponent of parents addressing and checking in with their kids and addressing the elephants in the room. But I think step 1 and 2 is probably making sure that they understand what the mitigation plans are going to be by the school district. And so staying informed with the schools and then taking that plan to their pediatrician and saying, so this is what the plan is. Do you think that there are any concerns, and how would you advise us in terms of dealing with that, so that when the parent then checks in with the children, they can sort of have a response when the kids are nervous to say, well, we've checked in and we understand X, Y, and Z is how the school is going to handle it, and that Dr. Smith said that, we're safe and that we should do A, B, and C. And so staying informed as well as checking in are two key factors.
And you just said a little bit of how parents should respond, but are there certain phrases or ways to go about talking about this with children so you don't make them extra nervous?
I would say being upfront about how you're feeling about it too, because even if you don't say that, your anxiety or your feelings about it, and your confidence, if you're confident about it, are going to come across to your kids. So saying things like, we're in this together and I'm here to support you and make it as comfortable and successful a school year as I can is really what we're after. But I think those things are really helpful, and just honesty and openness, and also, kids know when parents are informed or when they're sort of faking it. And so being honest about what you know and don't know are two really important things.
Some good tips right there. What are some telltale signs that you've been seeing that maybe parents, teachers should be looking out for?
I'd say for kids that have had problems with either separation from home or family before, should be aware that those issues could be more prominent during these times. I'd also say that if you're seeing some kid who was previously really, really comfortable both socially and academically, and now find themselves struggling to either keep up or make friends or keep up with their grades, that those are real big signs. Also, in terms of, attitudes and behaviors around the house, if you're seeing somebody who's withdrawing more or acting out of character, then it's probably time to be a lot more direct about talking about these things and maybe seeking advice from people outside of the family unit.
Absolutely. Dr. Newfield, we appreciate your time this morning. It is so crucial that we are paying close attention to our children, especially right now. Thank you for your time.
Thanks so much, Alyssa.
Absolutely.
Bye.
And we'll be right back.